Chairman. Thanks for holding this hearing. Ms. Ashinsky, recently the VA committed to proactively contacting new transitional service members through the Solid Start program, and your testimony credits this directly to the President's 2018 executive order focused on mental health for transitioning service members and veterans post-separation. What type of suicide screening is being done through this program, and how does VA plan to track its success?
Thanks for the opportunity to comment. I'd actually like to ask Dr. Carroll if he would. He has much more information about the detail of that program to address the question you raised.
Okay.
Thank you, sir. We appreciate the question. Solid Start is a transformative initiative that, with your support and that of the administration, VA has undertaken. It's taken us a while to build this capability, but within the first year after separation from service, we are calling each transitioning service member at least 3 times. To the point of your question, the contacts are checking in with the veteran. They are not clinical contacts. It's not a clinical interaction with a clinical provider screening them for suicide, but it is the caring support. It is making sure that they are connected, that they feel connected, that they know how to connect to either resources in the VA or the community. And then if they need something or they indicate, you know, if there's a crisis, we will hand off a warm handoff to the crisis line. If they need some other service from VA, there will be handoff to service. But it is really to remind veterans that they are not alone, that the VA is there for them as well as local resources.
But let me ask a question, clarification, because I know we had language in the Mission Act. Can a veteran go to a community health center, a walk-in clinic, or what have you, to seek private care for mental health counseling, what have you, and with the VA reimburse? I know there's some language there. I've had some legislation to strengthen that. Where are we on this? Because I think it's so very important. Now, if you can't answer the question now, please get back to me. You know, has this been implemented? How easy is it for a veteran, you know, for convenience purposes too, to go to their local community health center for mental health treatment?
I believe after an initial approval, it would be very easy, but I would like to confirm that for you for the record to make sure that could someone do it without authorization?
Anyone else? Okay, well, please get back to me on this because I think it's very important that the patient, again, the veteran, have access to these services. One more question. I just had cataract surgery, so forgive me. It's tough. Ms. Ashinsky, what type of suicide prevention materials or training is provided to service members as part of the VA's portion of the Transition Assistance Program?
Again, I'd like to recognize Dr. Carroll as our expert on these programs.
All right.
Please, Doctor.
Thank you. So over the last couple of years, the Transition Assistance Program has been remodeled, redone in collaboration with DOD, our DOD partners. And I think there's an entire day that is focused on VA services, on VA care. There's a focus on suicide prevention, how to register for care. In fact, we actually asked them to complete an application for VA care that can be activated as soon as they are separated from service. And there's information about suicide prevention and how to reach out for resources. And what we are also trying to do is to include information for family members, so family members also have that information as well. And then these calls that you mentioned earlier, sir, will remind them of that opportunity going forward. And if I may just circle back to your last question for a moment, if any veteran ever contacts us, we're going to find help for them today. And so if they come in and whether they're registered with us or not, if someone calls us or walks into one of our medical centers, we are going to find help for them today if they need it.
Okay, that same day?
Yes.
Okay, that's so very important. Time is of the essence in a lot of cases. Ms. Ashinsky, or whoever wants to answer the question, whoever's qualified to answer the question, you mentioned Ms. Oshinsky, you mentioned briefly in your testimony about the whole health program. As a strong advocate for this program and the use of a public health and whole health wraparound approach to suicide prevention, I want to ask, what progress is VA making in implementing findings for evidence-based alternative therapies that are otherwise outside of VA's traditional mental health system? I know that my local VA hospitals do an outstanding job with the alternative therapies, but I want to see this nationwide. So can you, whoever's qualified to answer the question, I appreciate it.
I can help with that one. Thank you for the question.
Okay.
Whole health is currently being expanded across our system. While we started out with 18 flagships, each of the network has been asked to identify 2 more facilities within their network to be able to expand, but also to spread across every single facility in the country. So in the coming year, we'll be doing increasing training, but I can tell you right now, people feel exactly the way you do. They can see whether or not the evidence-based is all out there, and I understand we are probably close to being able to issue a report with research on that. I haven't seen it yet, but I understand it's in process.
Yeah,
that really
it's gotta
shows that this
yeah,
is
we're waiting
something that
for it.
makes a difference.
Yeah.
So everybody wants to do it. They're doing it whether they're identified as a flagship or not.
All right, very good. Thank you. I yield back. Thanks for giving me the extra time, Mr. Chairman.
You're
I
welcome.
appreciate it.
You're welcome,
Thank
Mr.
you.
Bilirakis. Mr. Brindisi, you're recognized.